Welcome back, everyone, to our third session of our Early Intervention Forum today. We have Danielle Nelson with Uncovering the Roots of Behaviors, Sensory Challenges, and Delays. I'm going to read over Danielle's bio and then hand it over for her to start her presentation. Danielle started practicing as a pediatric occupational therapist in 2010. Throughout her career, she gained experience across settings, including early intervention, schools, outpatient pediatrics, skilled nursing, inpatient psych, acute care, and home health. Danielle has trained renowned functional neurologists to learn more about the root causes of their clients' symptoms. Through neuroplasticity, we can facilitate growth and maturity to reach goals and improve quality of life across settings. Danielle?
All right, thank you, Erica, for reading that as well as having me today. I'm excited. So using neuroplasticity to reach developmental milestones. So it's utilizing some of the central nervous system input techniques. So when you see CNSI down here, that's what it's standing for. And we'll kind of go through a little bit more about that. Erica already read this. I wanted to give you a little bit of background of I do have early intervention experience. I started my career working out in pediatrics at a sensory-based clinic, sensory gym. But from there, I trained with functional neurologists to really learn the root of what is sensory processing. And that's what brings me here today. I've learned a lot. I've learned a lot about the vestibular system and vestibular processing that I wanted to share, and how, why do my patients always have like chronic ENT issues along with the sensory processing, and how can we actually exercise the brain where the sensory processing is happening to reduce or potentially eliminate symptoms. So recently I started central nervous system input, which is an occupational therapy brain certification program to teach OTs how to assess and exercise the brain. And I started that with a friend of mine who's a neurologist, Dr. Matthew Ember. And so he has analyzed thousands and thousands of neuroscience literature to figure out, what assessments are most accurate, as well as how can we increase the frequency of firing in weak regions of the brain. So the brain is all electrical energy, right? It's neural connections happening, but how can we increase how many are happening, as well as the speed at which they are happening? So we treat all different kinds of conditions. So we treat a lot of childhood conditions, including trauma and sensory, anxiety, CP, developmental delays, fetal alcohol, Tourette's and tics. But then we also treat adults. So that can be adolescents, young adults, through older adults, and just age-related decline and balance conditions, or migraine, vertigo, autoimmune conditions, POTS and PANS and PANDAS, all different kinds of stuff. So that's just a little bit about who we are. We're traditionally, when we try to look at the brain, a physician will maybe order an MRI or a CT scan. That can be fairly limited because it helps us definitely identify if there's something major happening in terms of, do we have a tumor? Is there a bleed? And so that if we go to the hospital, the physicians know how to save our lives or get us on medications that are going to help live as long as possible at the best quality of life. What it doesn't show are the very small lesions that are impacting function, but not necessarily serious health concerns. So that's what I want to talk a little bit about today, as well as what we do in CNSI is determining what part of the nervous system needs our help at a functional level. Okay, so the cognitive neuroscience field was born in 1980s. Neurology was born much earlier than that, in the 16th century, but research really started happening again in the 1980s, and then substantial growth following the use of fMRIs on humans in the 1990s. Additional growth with research, in the research following media attention. Whenever we get media attention, we're getting funding, right? And so why I wanted to put this in here was just to point out that neuroscientists have learned a great deal over the past 2 to 3 decades. And how do we apply that to what we're doing with our kiddos, especially in early intervention when, as we know, we can make the most progress and the brain's probably the most plastic at that stage. Okay, so that was the who. This is a little bit of the why. 1 out of 5 kids have developmental disabilities. 1 out of 9 have ADHD. 1 out of 13 have asthma. 1 out of 36 have autism. And the real kicker for me, that is my passion, is that suicide is the 2nd leading cause of death in kids 10 to 14. So just let that sink in a little bit. You know, our kids are killing themselves because they're so stressed out or they're suffering. And what are they suffering with? And what is mental illness? You know, it's, you know, anxiety is a signal that something is going wrong. What's going wrong within our nervous system? And what is mental illness? You know, it's all neurotransmitters. It's all coming from the brain. There's obviously situational things that can exacerbate it or situational things that are temporary. But when we're living with chronic conditions and chronic suffering, how can we figure out where that small lesion is and go in and exercise the brain and have the brain work more efficiently to reduce symptoms? So another little fact here is that 60% of adults have a chronic illness, and 90% of the nation's $3.8 trillion per year on healthcare costs can be attributed to chronic disease and mental health conditions. So I know you guys are in early intervention, but those kids grow up, right? And how many of those kiddos right now have an autoimmune condition that they don't know about, or will eventually be diagnosed with anxiety or depression? So it all kind of webs together. So this is, I just wanted to put that out there to kind of know where we're at and why I am so passionate about bringing different neurological interventions, and why I think it's so important that all of us have a better understanding of our nervous system. Okay, so the rise and prevalence of autism, right? So you can see this diagram from 2000 to 2020. So this is when we were at 1 in 150, right? And so you can see that just climbing. And if we continue on this trajectory, it is estimated that 1 out of 2 kids will be diagnosed with autism by 2050. 1 out of 2 by 2050. So we have to make changes, right? And there's multiple things that go into this. You know, the why is a really complicated thing. There's a lot more research happening right now with what's going on in the gut microbiome, and you know, what are we eating? What are we drinking? What are the chemicals in our environment, our hair products, our carpet, our that's compounding in our system, that is safe at the level that it's in each individual product. But if every product that we're consuming has a little bit in it, it's compounding and staying in our system and building over time, as well as being passed on through generations. So that's kind of a functional medicine approach to it, which is outside of my scope as an occupational therapist. But I did want to bring that up, that looking at, you know, what's going on inside of our body, but how can we as family members and practitioners provide more advanced neuro rehab to improve how the nervous system is functioning, how it feels safe, and how it is learning new things and reducing the need for sensory seeking and you know, behaviors and things like that. Okay, so the last statistic that I wanted to talk about was with NAS, increased 383%, right? It is drastic. 59 babies per day are born with NAS in the US. And so I wanted to put this slide down here to really make sure that I was, I know you guys, a lot of you see a lot of this, and the symptoms that you're seeing in front of you, how they're related to the nervous system. So that hyperirritability, the jitteriness, the tremors, all relates back to the brain. The CNS is the brain and the spinal cord. And then the autonomic nervous system is our sympathetic and our parasympathetic, which is our fight, flight, and our rest and digest. So fight or flight is increasing cortisol and adrenaline and increasing heart rate and shallow breathing, right? It's what we go into with our survival protective mode. And then opposite of that, it works like a teeter-totter. If we're in straight that, then we are off with rest and digest, our parasympathetic. So you can hear rest, sleep disturbances, digest, GI symptoms, poor feeding, regurgitation, vomiting, diarrhea. So this is trauma at a nervous system level. So the drugs interfered with the nervous system development and maturity, as well as now we're having symptoms of withdrawal, right? So combined GI losses and excessive, excuse me, autonomic stimulation can lead to weight loss and failure to thrive. So it's just starting to think about the symptoms that you see in front of you that are presented, circling that back to regions of the nervous system and starting to think about the brain when we're treating these kids and how we can help the brain mature is really what I wanted to point out with this slide. Okay, so rolling into that is, what is this nervous system telling me, right? So whenever we start with treating a new child, right, or we're looking at meeting somebody, or it's our own kid potentially that's in front of us and they are having these behaviors, and how do we help them? We don't necessarily want to look at the behaviors themselves all the time as they're making a choice, right? Most of the time, especially when we're talking about under 3 years old, the nervous system is reactive. It's usually a stimulus. So when you see, a reaction to a stimulus, when you see a behavior, it's most often that it's their protective responses acting out, right? And so we're trying to figure out what's going on in this brain. What is making this brain not feel safe? Or what does this brain need, versus how do I put a consequence on this child because of this behavior? Or how do I force them to do it even if there is a behavior? So there are, of course, behavioral approaches to things, and those can help. They can help provide structure, and that structure also makes the kid feel safe. But we have to be thinking about it from multiple angles. And so when we ask ourselves, what does this nervous system need? It is always safety first. So whenever we see a kid that is potentially hiding under a table or running around or avoiding a task, is sensory seeking, is having behaviors, hitting, kicking, that is, we need to go to their fight flight. That is their defense mechanism turning on. So often a parent would want to say no hitting, right? And that's true. That's often a parent's job, is to set boundaries and consequences for things, so they know what's going to happen, and consistency. But also as a provider and trying to help this nervous system rehab, we have to recognize that that's what it is that's happening, right? So this is what we're going to go through today is how do we help a child feel safe? How do we help their nervous system feel safe and let go of their protective reaction, as well as once we feel like we've gained rapport and they're feeling pretty safe, how do we start increasing the frequency of firing in some weak regions of the brain? And how do we even figure out what regions might be weak, right? Okay, so just taking a minute to really talk about fight or flight, and there's freeze in there too, but how is that correlated to sensory processing, right? So it's fight when we're constantly in fight or flight. Well, let's back up a little bit. Fight or flight, the typical example is when we're going for a hike in the woods and we hear some loud noises over in a bush, right? So we're hiking along, we hear a loud noise. What do? Do we just ignore it and keep walking? No, we're in the woods, right? That could be an animal, that could be danger, that could be, you know, a risk to our survival. So therefore, we're going to look, We're going to pay attention. We're going to be listening. We're going to be listening with all of our senses to like make a decision as to what to do. So if we look and we see a bear, it's going to be reactive. So we're not going to think, what's my best case of survival here, and take our time to really think through and access our frontal lobe and think about planning what to do. No, what fight or flight is to just say, oh, that bear hasn't seen me yet, freeze, don't move, right? How can I survive? Or it's going to say, that bear is looking right at me and it looks like it's about to charge. Like, I need to find a weapon and I need to run. Something, it starts coming at me, then I need to fight back. How do I survive in this moment? So if we're talking about a child being in fight or flight and then being in that state, right? Where if they're chronically in that state, then that's going to, for them to be like, I need to look, I need to listen, I need to pay attention to everything. What's this over there? And what's that over here? And so if they hear a noise, it makes it really hard to tune out that irrelevant noise, that irrelevant background information, to focus on what a parent is saying to them or what their teacher is saying to them, or to visually sustain attention to something for a longer period of time. So I'm sure you can hear some things there that sound familiar, right? When they're always perking up and listening that something might be dangerous lurking around the corner, it can lead then to overstimulation, defensiveness, irritability, strong overreaction, inability to tune out information. And that's a lot of work processing everything in our environment all the time. So that's going to lead to that mental fatigue and those strong emotional reactions as well, right? Because now we're tired. And insomnia. So if I am in this fight or flight that I can't come out of, how do I go into rest and digest when it's time for bed? How do I unwind and tell my body that I'm safe and I'm okay, and it's time to close my eyes and go to sleep? And then, of course, if we are not getting sleep, then that also plays a role in our behavior and what we're able to learn. So I have one more slide here about fight, flight, and that same example. So when we're in that fight, flight state, number one, we're releasing adrenaline and cortisol, right? So those chemicals that are just telling us to go, as well as their stress chemicals. Okay, so it's putting us from this calm state to up here. So you can hear again how that could make us more reactive and more emotional, as well as our frontal lobe turns off. So our frontal lobe, I like to think of it as the top of our pyramid of our brain. So we're talking about safety first down here and some other things today. The frontal lobe is the top. It's right here at our forehead. It's our stop button and our filter. So whenever we think like, oh, I got to go and do this, it's the one that says, no, stop. First, go ahead and finish this and put this away where it goes. So it's impulse control, that's stop, right? And then it's also how do I plan, right? How do I plan what's next? I have my working memory of, okay, yes, I need to do that. I'm going to hold that right here. But first, I'm going to finish this. And then I'm going to work on this next and work through it. And now I'm going to do this. So it's all of our executive functioning skills. And so that impulse control and that working memory. So if I tell my 2-year-old to go grab, 2.5, let's say almost 3, to go grab socks and shoes, and they get, lost in their room and don't come back with anything, it was their working memory as well as impulse control. They saw something, it was a stimulus, their impulse control didn't stop them and say, I'm supposed to get socks and shoes, as well as their working memory, what am I supposed to be doing right now, wasn't holding on to that information. Or maybe they could remember one, they came back with shoes but forgot socks. Okay, so those executive functioning, that area of the brain turns off when we're in fight or flight. So this is why it's so key to start with safety first, because if we want to work on some of those higher level skills, even coordination, bilateral coordination, crossing midline, our grip strength, our fine motor, imitating shapes, right? We have to feel regulated and safe. So that's how it all kind of ties together with the sensory processing and ADHD. Okay, so in a sensory in a safety first approach. How are we going to help this nervous system feel safe? So the first thing that I do in any evaluation, right, when I'm first meeting a child, is that I'm going to limit talking as much as possible, which seems kind of odd because we need to gather intake, right, and history and talk to the parent. We need to educate. But I try not to do that right away, right? I try to dim the light. I don't always play calming music right away because it can be really irritating to some, but some kids really like it. Allow the child to come to you. So often sitting in their space and playing without any direction or eye contact or pressure is usually how I start with this age group. So anywhere from a 1 to a 3-year-old, I plan on going in there, bringing some toys that I control. Maybe I bring out one at a time, and I am just playing with my toys like I'm a kid. I'm building my blocks. I'm making a train. I'm making noises. I'm playing with my toy car. And so that shows them that I am not a threat to them, that I'm not forcing them to do anything. Because whenever we go right in and we start putting some demands on a child, come sit, come do this, it's all of a sudden, whoa, uh-oh, what are they going to do, right? Not every kid, right? Especially there's some kids that just, you walk in there and they're running around and they have no idea, but that's a different child with different behaviors that they're exhibiting, but they still could be in fight or flight, right? And so even that child, if you're like, get over here, come on, let's play, let's do this, right? It can still be an avoidance, a running and a fleeing that they're doing to avoid the task at hand. But coming back to just allowing the child to come to you and or finding what they're doing and joining them and their choice, right? And sometimes it needs a little bit of structure. So if it's that super busy kid that's running around, but what are they doing? Are they just running? Are they jumping onto the couch? What kind of input are they looking for, and how can we do that in a safe way? So making sure we're not just trying to get them to come to us, but we are going to them. So even if this is a child who is, not playing appropriately with a toy, they're stimming, I would encourage you to consider joining in on that, seeing how it feels to them, coming into their world and joining them. You'll be surprised as to what kind of responses you get sometimes. Sometimes that child doesn't even, notice you, or it doesn't look like they notice you. Other times you'll get kids that don't make eye contact or haven't looked your way at all of a sudden be like, oh, like, what are you doing? And they're seeing your attempt to join them and come in and be with them. So that's not the whole treatment plan. Don't get me wrong. I'm not saying that we're just going to do that, but that's the first initial maybe couple interactions where we're really getting to know the kid and letting them know that we see them and we're here with them, and we're not just here to do something to them. Okay. And then we can we're going to go through the presentation a little bit more today where we can see, okay, then what, right? Once rapport is built, we can set clear expectations. We can work on maybe having visual or verbal schedules and timers. So that structure can feel really safe, but we have to make sure that we're meeting them as to what they can achieve without too much work, right? Because if it feels like too much work, that fight or flight might kick in to now they're running the other way. No, like, I want to do this instead. And it might look like they're acting like a class clown. However, they just are like maybe mentally fatigued and they can't do it anymore, right? So it's finding that just right amount. And whenever you present a task to them, if you get behaviors, right, or avoidance, maybe think about either in that moment or the next time decreasing that, as well as limiting the words and the amount of times that you're asking them to do it. So sometimes what I do, if I'm, let's just say we were asking them to do a little obstacle course with a balance beam. We put some tape on the floor and we want them to walk across it. And we've asked them 2 times, okay, come on over and do it. And they're not, right? At that point, I'm not going to keep asking. And I'm also not going to get stern and say, now, right? That's my approach with this age, is a more play-based approach, because I don't want to trigger that fight or flight. I instead want to help them be successful in this, and I'm going to maybe come and help them. Okay, like maybe I'll pick them up and help them do the line, and then we're celebrating. Yeah, we did it. So even though they did it dependently, or I was holding them while I did it, we still did what I asked, and they didn't have to, they saw that they could do it in some way. And maybe now this time, before I ask them to do it again, I'm going to take that strip of tape that I have and multiply it by 3. So it's really wide and it doesn't look very hard. And maybe I'm going to bring a game into it where they have to pick up a ball, walk down the line, and toss it into a bucket. So I'm bringing that motivation and fun to it. But it's work for their brain, but it still feels safe and achievable. Okay, so that's kind of setting up the environment, thinking about our therapeutic use of self in these sessions to promote safety. There's also physical exercises that we can do to promote safety. So humming and gargling, it may seem kind of silly, but it is a way to activate our cranial nerves that go right to our brainstem, and specifically our medulla. And some of our cranial nerves, like our vagus nerve, you may have heard of that, which helps regulate our heart rate and kind of lower that. So we can do just, you know, hum a song where they can say, can you do what I do? And then they do it. Or we're humming, you know, row, row, row your boat. So fun little things like that can be a physical way to provide input to help them come down and come out of fight or flight. Another one is these next exercises. I want you to know I have slides coming up with videos to show you what these are. So I'm just going to run through them really quickly. Rhythmic rocking. So it's a rhythmical movement that they can do on their back, their belly, on their hands and knees, or we even do one where they tuck into a ball we call super ball rock. Fear paralysis. So that fight, flight, freeze. Fear paralysis is really that freeze. So that's really associated with kids who are that no, those no defiant kids. No, I don't want to do that. Even if you think it's something that they would like or enjoy, and their first response is no. Those avoiders, as well as our kids that look like they're in the fetal position. Our hiders, our ones that are hiding behind mom, the ones where it's really hard to get them to do anything. That's fear paralysis. And then we have our moro startle reflex movement. So it's our startle response, which when, you know, somebody comes around the corner and we don't see them, our heart rate increases, our breathing shallows, and it takes a minute. We go into that fight or flight, and it takes a minute to come out of it. So we have some movement patterns to help us come out of that state. Isometric exercises. So isometric is holding a position. So that can be, you know, holding our arm out like this and just holding and holding, as well as laying on our belly, doing Superman, doing plank, like the push-up positions. Downward brushing. So I'm sure a lot of you have seen the surgical brushes, and there's a protocol for it. We don't use the protocol. We just tend to use it as a regulator to help them feel calm and safe of just downward brushing, and then a tuning fork, which we'll get to as well. Okay, so here is a video of the rhythmic rocking. Megan is doing rhythmic rocking. She's laying on her back, pumping her toes to make her whole body rhythmic. Here she's doing a modified version that's typically a little bit easier to get started. Okay, so with this can be done actively, like Megan is doing in the video, or it can be done passively, where you are going up to the child and taking their foot and rocking their whole body up and down, or they bend their knees and you take their knees and you push them back and forth. The key with this exercise is that they're getting a lot of tactile and proprioceptive input from the mat or the floor that they're laying on, as well as getting that rhythmic movement. So I like to explain that as just like when a newborn, we rock them, we pat their butt, we give them that rhythmical input. So many neural connections and feelings of safety and security come from that. And you can watch a kid that is super busy running around the room. You get them to lay down and you just start pumping right away. And with some kids, it'll be faster than that. Those really busy kids, I usually use a faster tempo when I'm rocking them because they need a little bit more, and that helps them feel a little bit more like, I can breathe. And you can see them do that. You can see them almost just melt and give way. And that's what you're looking for. You're looking for that system to turn off, their muscles to relax. Okay. Because often our muscles are tense and we have, tone because we're in fight or flight. And I'll talk about that with the next movement patterns as well. But this can really help break that up and get us in that rest and digest state. So we often do this right away. It's one of the first exercises that we do. And by the way, that on the back there, that Brain Bright Therapy, that is the clinic that I own in Toledo, Ohio there. So we have our YouTube channel. So you can, this is open to the public. You guys can look up these videos that I'm going over today and use them to help. We even send them home as home exercises where a parent can just put it on an iPad or whatever, and they do it with the child. Okay, that is rhythmic rocking. Okay, so this is the supine flexion rocking where she's tucking into a ball and going forward and backward. So again, the child can get into a ball. You can help hold their hands and their knees. Super ball rock. Just one hand on each knee. A lot of the early intervention kiddos are probably not going to be able to do it this way. It's probably going to be more passive, where you're holding their arms and doing it with them. Okay, so here's the fear paralysis. That rhythmic rocking on their back is usually the first one that we do, and the fear paralysis is the next one that we'll introduce, that are passive ways to promote, especially getting them out. If they're showing any of those kind of shut down, paralyzed, selective mutism is a big one for this. We're going to start with moving their body for them. So she's going to start with moving her legs from side to side. So she's doing it actively here. But if I had a child, I got them laying down, I would be moving their knees for them if they can't do it independently, especially in the beginning when we're first teaching it, right? And so the idea is to go a little bit slower, making sure we're resting in each position and letting those muscles relax in that position. Now, if that doesn't happen, or the kid's getting anxious and wanting to get up, I might speed it up a little bit more to get them through it and get them used to the pattern as to what I want to do. So you can see this is moving really slow. That's the goal. I'm going to take you through each one really quick. Knees go side to side, then it's one leg up and the other leg up. We actually named these with different animals. So we have like a shark fin, and now this is flamingo. And then it goes into frog, where she's going to bring both of them up at the same time. And we have a handout of pictures of this too, which I just thought of might be really helpful versus just learning it through the video. But I do recommend that you try it yourself. You go home, you bring up the video and run through this and see how it feels, right? So usually when I start with a kid, I would have them do maybe just 3 of these exercises at first, and then we'll build upon it as we go and possibly slow it down as we go. So we're crossing the ankles, and these are all functional patterns that are built within our nervous system, and we're trying to break the fight or flight fear paralysis and let that go. And often kids, once we break the fear paralysis, the shutting down, they'll move into more of a fight flight, where they're a little bit more aggressive, where they're kind of standing up for themselves and saying no. And then we start doing some of our startle reflex exercises, or we keep doing this exercise. And usually about a month later, they're coming out of that, where they're a little bit calmer, and you're not seeing that fight or flight response. So this is the exercise for that that startle reflex. You know, when I go startle, my arms go up like this. And so it involves
the starfish exercise.
Let me mute that. When you open, this is the full exercise. I'm breathing here. So I'm breathing in and opening, and I'm breathing, exhaling and closing. I have the same side on top. So right now my left arm and left leg's on top. And then the next time I'm alternating to where my right side is on top. So then this is, that will be pretty complicated for this age group, but I wanted you guys to see it. This is really what it looks like when you have a 2-year-old that you've maybe been working with for a year or so. You might want to start adding this in where you're sitting in front of them modeling this. Maybe especially if they're kind of having some aggressive behavior, they feel like they're in fight mode a little bit, or they're overly emotional and reactive and having meltdowns. That would be a good thing to do. And then you can see I add my head into it. And then last, I would add my breath in. So as I'm teaching a child, I would start with arms and legs, or maybe just arms, and then maybe add head movement with it. Again, with this age group, you might not get that far. But that is for the Moro startle reflex. Okay, and then I talked about the brushing, right? So one thing that I want to talk about with the brushing is most all of us have access to these. They're fairly cheap on Amazon. We can get families to get them. So that's why I wanted to talk about it. Most of you guys, I'm sure, are familiar with them. However, everybody uses them a little bit differently. So I wanted to share what we have found in terms of the nervous system and what it wants. Because we're not necessarily using this for tactile defensiveness. We are using it to promote regulation, especially when a kid is running really high and we want to what's called down regulate them. We're just going to be brushing down. So it's still the concept of more pressure. We don't want light touch here. We want the bristles to bend as you're pushing. And we want to maintain contact with the skin, you know, not constant contact, right? But we're not going to just kind of do this kind of thing. It's going to be smooth, rhythmical, and down. So that could be on the arms and legs. And the same idea as the rhythmic rocking. There's some kids that just really like this, and it helps to bring them down. And once they're down, then we can do more. Okay. The tuning fork is the same way. So this is one thing that maybe you guys have not seen before, unless you're musicians, right? So a tuning fork, I'm hitting it and now it's vibrating, and there's different hertz. 512 is what we recommend. This is actually a 128 here that I have, but it's going to vibrate, right? And it's going to keep vibrating this whole time. So now I can put it on my hand and I'm feeling that vibration all the way up my hand, and it's actually going up through and across to the parietal lobe, processes sensory information, which we'll talk about here in a minute. But it's also those kids that just need a little bit more inputs. It can be really calming for them. Okay. So sometimes that vibration, you may have played around with vibrational toys. This is a way to isolate the input. So a lot of times there's different things that kids can sit on, or there's those little massager toys, and those are really helpful. But I wanted to bring this up because if you learn a little bit more about CNSI, right, and we're going to go over that here in just a little bit, you can do it on their fingertips. So rather than it being on their whole hand or all over their body, we're hitting these left fingertips because we want to hit the right parietal lobe, because they do have tactile concerns, right? They do have meltdowns about getting dressed. They do lack body awareness and proprioception and where they are in space. So this is a good tool to help provide that input to that region of the brain, being more specific, put it that way. Okay, So we went over those ways to set up the environment, the therapeutic use of self, as well as some physical exercises to promote safety and help to pull a child out of fight or flight, or at least not exacerbate them deeper into fight or flight during the session. When you take that approach and really build that rapport, it can make a big difference with a lot of kids. So we have that. We've been doing that maybe for 3 sessions, right? And now where we taught the parents how to do rhythmic rocking and fear paralysis. They have a brush at home. You've tried out the tuning fork. They're a little iffy about it. Let's say that's where we're at, right? How do I go even more? How do I do more? Well, we want to do a basic brain assessment. And so when we do that, we want to look at whether their right or their left brain is more dominant, right? Because a lot of the times, especially our kids on the spectrum, are really left brain, literal concrete thinkers, and their right brain is lacking. And so just what I was just talking about with the tuning fork, we're going to want to balance the brain. So the whole goal of making our brain run more efficiently is what's called homeostasis, getting it to a balanced state. Whenever we are really unbalanced is when we're going to have symptoms. Okay, so we want to figure out if they're right or left brain dominant. We want to maybe try to look at which region of the cortex, is there parietal lobe sensory processing stuff going on? Is there frontal lobe, occipital lobe kind of stuff? So I'll talk a little bit about that in more detail coming up. And this one is interesting in terms of it's really complex eye positioning and what's going on with the eye. I know you guys have seen it where one eye is really turning in on a kid or one eye is drifting out on a kid. And that is an extreme severe case where maybe an optometrist or ophthalmologist is referring them for surgery potentially. But what if it's not that severe? And what is it telling us and what can we do about it? Right? So the eyes are the receptors to the brain and are mostly controlled by the brainstem. So our vestibular system, our inner ear, and our brainstem help our eyes kind of work together and create a big picture. And it's processed, that visual information is processed in the occipital lobe, but it starts, those eye positionings especially come from our cranial nerves and our brainstem. So it's very, whenever we have an eye that's just kind of sitting in, like maybe you're playing with something and you see that this eye really tends to go in more than this eye, what do we want to do about it? Well, we want to get the referrals out to, an ophthalmologist or an optometrist that looks at that and maybe can help with glasses. But glasses are often like a band-aid to that. It's not really teaching that brainstem how to use both eyes at the same time. Okay, so what can we do is we can teach the parents like, hey, I've seen this, number one, and let's just not encourage it. Let's maybe set up our toys over here because maybe when they're eating every meal, they're looking at mom this way, mom's over here, and so they're encouraging that eye to go in. So what I want to talk to you guys about today is just the basics. It's almost like common sense, like don't make it worse, just kind of set up things over here in that input. So it's what's called gaze fixation. If we're just fixating our eyes on a toy or something over here, that's going to stimulate the area in the brainstem that controls that and can help strengthen it. So looking at whenever you see small little eye positions, kind of knowing a little bit what to do about it. And then we're going to provide the brain input, right? So if we determine that this kid is right brain weak, how can we do it? Well, we can just use their left hand more during play. Maybe we have a little game where their arm gets put away in their pocket, or we're saying, okay, you found 2 toys in the rice bin with your right hand. Now I want to see if you can find 4 with your left hand and earn points to get a prize or something, or earn their free time or something they want to do. We can do more balance activities with their left foot to try to, because everything flows, especially motor coordination is going to flow through the cerebellum and across to the parietal lobe. So I have more slides on this to go a little bit more in detail. But when we provide the brain input, it can be as simple as setting up the environment, balance activities, eye exercises, which I'll go over really basic eye exercises and how powerful they are. Those vibration to the fingertips that I was talking about. And then just like really finger to nose type stuff. Things like this are, as well as they can touch a target. You know, you can put something out in front of them, is going to stimulate a region of the brain that's proprioceptive and activating where am I in space. Because if we don't know where we are in space and where we're moving, now I'm insecure. Now that's triggering fight or flight. Okay. So here's some basics on right and left brain. So you hear a lot of this in the histories maybe that parents might give in terms of what's a child's personality like. Like I said, the left brain is more analytical thought, ordered sequencing, rational, planning, math, logic. Our concrete thinkers that are very black and white are more left brain. And our right brain, it's really about intuition, emotional thought, non-verbal processing, okay? They're also adventurous, creative, and instability. Symptoms of negative emotions or nightmares are often stemming from the right brain as well. Okay. So like I talked about before, our brain really wants to be balanced and it's going to function the best. It's like a computer, right? It's going to run the best when it is balanced, and every part of the brain is functioning and functioning optimally, and we're creating equilibrium, a teeter-totter. If we're ever like this and imbalance, we're going to have symptoms. So if I'm stuck up high in the air and I'm impulsive and creative and intuitive, but I struggle with logic and thought, you know, then I'm going to have struggles. I'm going to have symptoms, right? I'm going to have maybe some ADHD type of things going on as well. We need to have a little bit of both and a little bit closer of a balance. And we're always, you know, most people are one more than the other, but they have to be close and they have to be able to communicate and go back and forth. You know, if I am really left brain, then I really need my routine and I'm gonna possibly lose it if, you know, have a meltdown if I can't. I'm literal, I don't understand sarcasm, maybe I'm more of a perfectionist, I'm missing some joy and some jokes. So, you know, none of that is really life, you know, interfering with our life necessarily, but it can be, right? It can be a result of so many symptoms that we see. Okay, so this is a poster. Don't get too overwhelmed with this. I just wanted to show you, I want to break it down. When I talked about the regions of the brain, the one where I want to start is the cerebellum, the gray one. My balance keeps getting worse and I've been noticing slurred speech. Okay, so I know that doesn't really sound like early intervention, but hypotonia does, right? Our low muscle tone kids that are floppy, they need cerebellar input. They need to exercise their cerebellum. We can do that. Those kids that just keep falling over, right? And just are always falling, or maybe you notice when they're playing with toys and trying to string beads that they have a little tremor when they do that. That maybe they have a diagnosis of ataxia, right? They're having meltdowns when you ask them to do something with their body, you know, come over here, come do this. They can't coordinate the movements. It's all cerebellar. And so how we can stimulate that is some of those isometric exercises that I was talking about, just holds, or non-linear movements. So if I'm just going up and down, that's a different area of the brain. But if I'm drawing circles or figure eights, then maybe I'm taking somebody's hand and I'm doing the figure eight with them. That non-linear, what we call like a complex movement, is really targeting. Like that right there was all my left cerebellum. So I could do that while I'm standing on my left foot. So doing those balance activities, or standing tandem, heel to toe, with my left foot and back. So I'm maybe walking across, like I mentioned before, that taped line. So even though they're low tone, how are we providing that physical, those balance and those basic movements, those even gargling exercises can be helpful for that. So I have a slide specifically for that. Sorry. And now we're going to the parietal lobe, because everything that flows, like I said, the motor coordination is going to go through the lower levels and up to the cortex. And our parietal lobe, specifically our right parietal lobe, is one of the main regions that we can do so much with to really help with sensory processing. So different sensations and textures really bother me. I tend to bump into things. I have my shirt on backwards. I leave stuff on my face. So those kids that don't have any body awareness, don't know where their body is in space, are really parietal lobe. And it's typically right parietal lobe, because remember, a lot of these kids are also maybe somewhere on the spectrum a little bit as well. As we know that our sensory processing and our autism, go like this. And I know that sensory processing can be on its own as well. But so there's exams listed there, but what I want to focus on are the exercises, because now that I told you that bit of information, you might be able to recognize it, as well as any tactile sensitivities or defensiveness, or, not liking tags or certain clothing bothering us, is usually a parietal lobe. So we often learn from a sensory integration approach, may just be doing like our brushing or tactile play, playing with shaving cream, rice and beans, doing that kind of stuff. But how can we target it and be more specific? Well, number one, we can be using our left hand to do things like I talked about before, because it's most likely our right parietal lobe that we want to get to. And then how can we do different things like graphesthesia, which is drawing different shapes, because we can do numbers, letters as well, but for this age, maybe we're just drawing a circle or a line, and they're telling us, they close their eyes and they just tell us, is this a circle or a line, right? And so then, or we might be doing stereognosis, which is just taking something familiar to them with their eyes closed and putting it in their hand, and they have to tell you what it is. Right? At this age, we may need blindfolds because they'll like to peek a lot, but that idea of just taking their favorite toy car and putting it in their hand, or taking a block and they have to tell you what it is. And then, of course, we're cheering and encouraging them, or giving them stickers or whatever every time that they get it right. Point localization is, it's same idea, but you're touching something, a place on their skin, and they have to touch where you touch. Okay. So it's really building, again, we can do it to the left arm to stimulate that right parietal lobe. Hi, Erica, are we getting close to time?
We are. You still have probably around 7-8 minutes, but there are a few questions in the chat just when you have a moment.
Yeah, why don't we go ahead and do that?
Okay. I will start at the top. The first question is there anyone in particular near the Columbus area that you recommend specifically for the safety first fly or flight approach to OT?
Not that I know of in the Columbus area. There is a clinic in the Cleveland area that we've been working with. CNSI just launched in 2023. So we are, this year in 2024, we're really going to be getting out there and training other clinics. So if you know of any clinics in the area that you already work with and you want to send, either send me their information or vice versa, we could possibly set up a training to do that. Also people who practice neurodivergent affirming practices, like maybe they mention that in their website, they're often coming with a similar model. And functional neurologists. So I do have some slides at the very, very end. So like right when we get down to it, I'll bring those up in terms of how to find referral places and things to look for.
Okay, great. The next one we have, will these calm or help kids who are sensory avoiders with rocking or inverting head?
Can you repeat the question?
Will these calm or help kids who are sensory avoiders with rocking or inverting?
Thank you. Sorry, I just wanted to know if they were asking if it would calm or if it would, increase their hyperactivity. Avoider, yeah, absolutely, especially because a lot of the input is coming from the ground or whatever they're laying on, and you're just kind of, if they have shoes on too, or have socks where you're kind of grabbing a little bit harder, where you're not doing that light touch and rocking them. Absolutely, that's what those avoiders, they're avoiding it because they're flighting or they're freezing, right? And so all of those exercises that we talked about are ways to calm them. But it's just finding what that child responds to the best and like the best. But it is very, very rare that we have a kid that does not like the rhythmic rocking.
Next, we have a statement and then a question. I worked with an active child who was missing part of his frontal lobe and found that lightly rubbing my finger over his palm and fingers to provide neurostimulation helped to calm him. What are your thoughts on that?
Lightly stimulation where exactly?
Lightly rubbing my finger over his palm and fingers to provide neurostimulation.
Yeah, I mean, I don't have any major thoughts about it except for that, like I said, you got to find what that child likes. And that child, it was rhythmic, it was soothing. You know, you were there, you were bonding with them, you showed them that you care about how they feel and whether they're upset or in fight or flight, and it was gaining that rapport. Um, you know, in terms of what type of input that was, it's hard to say. It was probably a little bit of parietal lobe, I would guess. But yeah, I mean, that's great. That's what we need to do, is find those things that work. And I'm trying to share what we found in general work with most, but you know, finding those little things that somebody really likes and it calms them, whether it's rubbing their head or whatever. You got to be careful with that because some people really don't like it, but that's the goal. That's the goal at first.
And last, we have, are you familiar with rhythmic movement training? Much of your information is similar to information they teach.
Yeah, absolutely. So rhythmic movement training, but you know, like the rhythmic rocking, that's what that is. It's the same idea, rhythmic movement training. And what that's kind of the start of it. Like I have a lot more that I want to go over that is more CNSI of providing that brain input. But I didn't want to skip over this part of just saying, you know, we need to do this into kids, because then we can be doing harm if we're not acknowledging the fight or flight and the rhythmic rocking, or like the calming effect that we need at first, and then that gaining rapport and that safety. So yes, and yes, I think it's a great resource to have, but I also think it's limited. Then what, right? Then what do we do to really promote some of these, the neuroplasticity in these brain regions?
Danielle, I did see a couple other questions in the Q&A section. Do you want to finish your slide that you had referenced, or would you like one more question?
Let's 1:30. Let me go through the slides really quick.
Okay.
The general idea with this one was just about trying to create neutral eye symmetry, as well as how everything flows through the brainstem and up through the cortex. And when we're doing anything with the eyes, it's going through the brainstem. So we can get so much through the eyes. And this is the slide that shows how our vestibular system, this is our vestibular system right here, our canals. And as we move our head, fluid and hair follicles run through these canals and bounce up into here. So the main thing I wanted to cover before I end, I'll wrap it up, Eric, I'm sorry, is the vestibular processing. When we talk about sensory processing, and vestibular is such a big piece of it, we often think that vestibular is movement and any movement. So getting on a swing, getting on a, you know, a scooter board or whatever. But what I've learned from now learning about the nervous system is that that's not vestibular input. Vestibular input is all with head movement and eye movement like this, right? And so as we rotate our head, we're activating our inner ear and sending signals in. So thinking about it more from a vestibular rehab point of view of how can we help them feel safe through their vision, vestibular, proprioception, cerebellum. That's how we know where we are in space. So I talked about the cerebellum a little bit. but the no-nos. So if you just hold up a toy, or if the child is looking at something and you can get this what's called a vestibular ocular reflex, that is really providing vestibular input and retraining their vestibular system. So you can also do yeses. That tends to be harder for kids. But you know, there's the details in here as to how you do it. As well as convergence. Just if you have a toy, they're playing with a car and you're like, vroom, 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 and you're bringing it closer to their eyes and getting their eyes working together and doing this. The eyes have the most receptors to the brain. And just like we know sensory processing is first and being regulated is first before we can sit and learn, it's the same idea of like the brain stem is the very bottom. And our vestibular system is the very bottom of what we need for higher level skills. So by just adding simple things like this to your practice, we even use like dots, stickers, whatever, can be super, super powerful. And there's tons of videos out there of like no, no's, yes, yeses. It's called the vestibular ocular reflex. This is in your slides that you have. I recommend looking up this video. It's long. I'm not going to play it out here, but this is what that looks like, the no, no, and the convergence. And then we went through, this is just a recap of we want to do basic brain assessments, right, left, eye positioning, looking at parietal lobe, and then the input that we want to start providing to try to have that brain work more efficiently, reviewing the safety first step. And then this is the last slide, a couple slides with referring to other providers. So I talked about, you know, the whys a little bit and what else is going into it in functional medicine and getting better testing and better treatment out there of really trying to figure out, okay, do I have all the nutrients that I need? Do I have too much heavy metals in my body? The JOS district is something, you know, a clinic, a family wellness center that opened in our region, but it is virtual. So I put that on there too. If you do have families that are really like, how do I do everything that I can right now? Functional medicine is my number one referral out of really making sure we're getting to the root of what's going on. And then I put in here neurodivergent counselors are super helpful. And then we have our OTPT speech. One thing I did want to mention is that the optometrist I have on here versus ophthalmologist. So even if somebody says I've had their eyes checked, you know, a parent says I've had my kid's eyes checked and they said everything is fine, that's only 10% of their vision. And usually that's done by an ophthalmologist or just going to any random person, you know, optometrist that's not really looking at how are the eyes processing information and how is the brain making sense of that information. So, you know, feel free to reach out or, you know, talk to other people in your community about who are the optometrists in your area that are really trying to treat the brain as a whole. And then we have chiropractors and functional neurology. Okay, I'm done.
Thank you so much, Danielle.